Hey everybody, it's Dr. Sam Robbins. Now, I received a really good question the other day about cholesterol, about erectile dysfunction and impotence, about heart attacks and strokes, and statin cholesterol-lowering drugs, and how all of these things are interrelated and, in fact, contradictory at times. Now, the viewer emailed and asked, I'm totally confused when it comes to cholesterol. I went to my doctor and my blood test showed I have high cholesterol. It was 253. My doctor told me to eat better and eliminate all cholesterol foods from my diet, and then prescribed me a statin cholesterol-lowering drug. I then also told him how I've been having erectile problems the past year. Things aren't working like they used to. He then said how high cholesterol can cause impotence and that statin drugs can help fix this. Yet, I go online and there's a ton of research and guys complaining how when they took statin drugs, they had erectile problems. And in a previous video, you said how cholesterol is needed to make testosterone, which is the main hormone that controls your sex drive. What the heck should I do, Dr. Sam? This is all very confusing. And yes, you're totally right. When it comes to health, things can be very confusing because there are studies or experts who say completely contradictory things, and at times it all makes sense. So let me simplify all this for you because both my parents had cholesterol problems back in 1998, over 20 years ago. And I needed to learn a lot about this topic back then when there was actually little information. And now, over 20 years later, there's a lot more data and facts, both clinical and empirical, basically real life stats about all of this. So let's talk about the cholesterol. First of all, yes, cholesterol is needed to make hormones, including testosterone. In fact, cholesterol is needed to make vitamin D, which is technically a hormone and not a vitamin. Now, people who have very low cholesterol levels typically also have lower testosterone and thus libido. And I've seen so many people who go on very low-fat diet or no cholesterol diets, right? And their testosterone levels drop like crazy, which is the opposite of what you want. Now, in regards to the statin cholesterol-lowering drugs, such as, the more popular ones like Lipitor or Crestor or Zocor, they lower your cholesterol by blocking the enzyme that creates cholesterol in your body. And yes, they do have a lot of negative side effects, such as memory loss, liver disease, diabetes, hormonal imbalances, and yes, erectile dysfunction. Unfortunately, doctors are just quick to prescribe these drugs. I personally believe that people who should take these drugs are those who have a genetic issues with it and basically a family history of very high cholesterol. So for example, if your cholesterol level is like over 350 and you're, younger age and you eat, fairly healthy and you're not like super overweight, then chances are you have a genetic problem. Then I would suggest extreme changes in your diet, like eating a plant-based diet and also using low-dose statin drugs. Now, the rest of us, we don't need these drugs. Lifestyle changes and supplements can easily fix cholesterol issues. In fact, there are natural statins found in nature that help lower cholesterol and don't have the negatives of these drugs, which I'll tell you about in a minute. Something also very important to keep in mind is that 80% of your cholesterol is actually made internally through your liver and thus not from the foods you eat. The real cause of high cholesterol, again, genetics aside, are the negative changes in your hormones, especially as we get older. And of course, your lifestyle and epigenetics contributes to these hormonal changes. And I discussed this in another video, which I'll give you the link to in a minute. But here's the bottom line. The main reason anyone wants to have healthy cholesterol levels or your doctor prescribes cholesterol-lowering drugs is in the hope of avoiding heart disease or atherosclerosis and thus dying from a heart attack or stroke. And yes, you need to have cholesterol levels for optimal hormone production and thus sex drive and erections. But cholesterol is just one factor, and it's usually not even the most important. What you need to do is you want to also improve your HDL-LDL ratios, and the particle size of lipoproteins matter. The fatty triglycerides, homocysteine levels, inflammation, and blood sugar levels all work together to cause, negative or positive health problems. And this is what I discovered with my own parents, during the past 20 years. So your goal is you want healthy lipid levels, not just lower quote-unquote cholesterol. Diet and exercise help for sure. However, a major cause will always be hormonal related and aging. Taking cholesterol-lowering drugs, do so only if you have a family history of very high cholesterol and you've improved your diet and exercise, you've taken supplements, and they haven't really made any improvements. Thus, drugs are your last option. And if you're concerned about erections, for sure, don't take the statin drugs. Now, below this video, I've got a link about how I lowered my parents' cholesterol and improved their lipid levels. It's a formula that I've been using for over 20 years, and you can use the same formula to improve your lipid and cholesterol levels while helping your erections and helping avoid a heart attack or stroke. Thanks for listening and have a happy and healthy day.